Working with Veterans, Part 3, Challenges. In the previous modules, we've explored the experience of veterans and the impact of culture in the armed forces. Now we'll look at the challenges faced by veterans during and after service, and the implication these challenges pose for clinical practice. The challenges veterans face can differ depending on their experiences both in the armed forces and when transitioning back into civilian life. We'll explore these challenges and reflect on how they affect each of the three brothers in our example differently. Veterans face several significant challenges that come about from the time they spent in the armed forces. These include the militarized threat system, moral injury, and survivor's guilt. Let's look at each of these challenges in turn and consider how they impact a veteran's ability to cope with trauma. Militarized threat system. Recruits in the armed forces are trained to become hypervigilant to their surroundings and trained to turn into danger. Recruits need to be alert at all times and react immediately to threats. The consequences of this militarized threat system is hypervigilance. Hypervigilance is an exaggerated startle response, which can lead to increased anger, and veterans defaulting to the fight response in civilian life. Although all three brothers successfully completed their training, the militarized threat system would be most prevalent in Simon and William. As Simon spent 10 years in the army and William spent 22 years in the navy, their military training would have been repeated and reinforced over many years. And as both Simon and William were involved in multiple tours, they would have put this training into action in combat situations. Both of these brothers will be hypervigilant, which could lead to complications in civilian life. To minimise the effects of the militarized threat system, it's important to help veterans understand what situations or environments can trigger these feelings, to remain calm when these feelings do arise, and to manage arousal using techniques such as breathing exercises. Moral injury can be described as perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. Moral injury. For veterans, moral injury occurs in response to actions they took or did not take during their time in the armed forces. They might also feel moral injury if they feel betrayed by a higher authority. Moral injury is experienced by veterans who go against their personal morals or beliefs. During his time in the Navy, William was involved in 12 tours. On one of these tours, he was given an order that he didn't feel comfortable with. The order involved a strike that would result in civilian casualties on the enemy's side. Despite his reservations, William carried out the strike and the tour was a success. This action went against his morals. William now feels resentment towards himself and the superiors who issued the order. Moral injury can lead to high levels of shame, so it's important for clinicians to be aware of it, maintain an unconditional positive regard when working with veterans, and take a non-judgmental approach. Survivor's guilt. Some veterans may suffer with survivor's guilt after they leave the armed forces. Survivor's guilt is a mental condition brought on when a person believes they have done something wrong by surviving a traumatic event when others did not. Survivor's guilt is a challenge that becomes more prevalent the longer a veteran has been in the armed forces. As both Simon and William were involved in multiple tours, they would have been exposed to combat trauma where they witnessed casualties and saw their friends dying. As well as contributing to mental health difficulties, these experiences could lead to survivor's guilt for both brothers. The implication of survivor's guilt for clinical practice is that it can negatively impact a veteran's self-appraisal. They could minimise their own needs. It could influence whether or not they seek help, and they may not feel deserving of any help. Veterans also face several significant challenges that come about from leaving the armed forces. These include making the transition back into civilian life, mental health difficulties, and complex risk presentation. We'll now explore these challenges in turn and how they impact a veteran's ability to cope with trauma. A challenge that many veterans face is the transition back into civilian life once they've left the armed forces. Transitioning to civilian life. The challenges that veterans face when transitioning to civilian life can start from the moment they're discharged, especially if they're forced to by a medical reason. Many veterans find it hard to put aside their military culture and training to adapt to civilian life, as there can often be a misalignment between the two. Transitioning to civilian life can feel like starting from scratch to some veterans, from having to find housing and employment, to the lost sense of camaraderie and belonging they may have felt in the armed forces. Michael spent a year in the RAF and was medically discharged after sustaining an injury. Due to the short length of time that Michael served in the RAF, he experienced the lowest level of detachment from civilian life compared to his brothers. Michael was able to easily rejoin civilian life and is of a similar age to other people starting entry-level jobs. Simon spent 10 years in the army and during this time went on 3 tours. Due to his time and experiences in the armed forces, Simon experienced significant detachment from civilian life. When rejoining the civilian workforce, Simon was older than most others starting entry-level jobs. He also felt a detachment from those around him who didn't understand his lived experiences. Simon sees himself as a military individual and misses the camaraderie of his military friends. William served for 22 years in the Navy and reached the Armed Forces retirement age. Compared to his brothers, William experienced the greatest sense of detachment from civilian life. After achieving a full career in the armed forces, he felt a loss of identity and purpose when retiring. He felt a loss of camaraderie and struggled to identify with the people in his civilian community. And he struggled to understand how to access health and dental services, as these are accessed differently in armed forces settings. It's important to consider the challenges faced by veterans when transitioning back into civilian life. Transitioning back into civilian life can cause feelings of alienation, where a veteran might question their sense of purpose, a lack of a balanced life, where mental health difficulties can lead to an inability to work, and the disruption of changing from their usual routine and occupation in the military. Mental health difficulties. Mental health difficulties can affect veterans of all ages. The prevalence of PTSD in the veteran population can vary depending on the veteran's role within the armed forces and their deployments. Despite PTSD being the most well-known difficulty faced by veterans, we see that adjustment disorder, alcohol misuse, depressive disorders, and personality disorders are all more common than PTSD. Veterans can experience mental health difficulties based on their time in the armed forces and after leaving the armed forces. Michael's career in the RAF being cut short could lead to mental health difficulties due to a lack of career fulfillment. Simon may face mental health challenges due to feelings of isolation. He's used to living, eating and working every day with the same people that understand his lived experiences. He may be unlikely to want to share his stories or feelings with his civilian counterparts. And William may face mental health challenges due to his experiences of combat. During tours, William may have witnessed casualties and his friends dying, or sustained injuries that required rehabilitation. We all have a limit to the amount of stress we can carry. Imagine that we have an internal bucket where our stresses are poured into. For veterans, there can be different stresses adding to that bucket. These include the stresses from their civilian life before joining the armed forces, the stresses from their experiences during the armed forces, and the civilian stresses now that they are a veteran. Without the ability to drain this bucket of stress, veterans may be prone to mental health difficulties that can affect their relationship with themselves and others. There are healthy ways that veterans can learn to drain their bucket. These include developing coping skills and resilient behaviours, turning to family and friends, establishing a routine, medication and therapy, and building an infrastructure for themselves. Complex risk presentation. Male veterans under the age of 24 are 2 to 3 times more likely to end their life by suicide than the wider population and other serving personnel. This is especially true if they had a shorter period of service and served in lower ranks. Veterans face many challenges, especially when transitioning out of the armed forces, which increase their risk of suicide. Veterans might believe they're a burden to their loved ones and/or society. They might feel isolated from a community who do not share the same values or shared experiences, and they may be desensitized to violence through repeated exposure in service. While complex risk presentation can pose challenges to all veterans, there is a prevalence in younger veterans who have left the armed forces early. Although Michael spent the least amount of time in the armed forces compared to his brothers Simon and William, he feels the lowest sense of fulfillment due to his career in the RAF being cut short because of his injury. This puts Michael at risk of suicide and complex risk presentation. It's important to consider complex risk presentation when assessing risk. If a veteran shows signs of complex risk presentation, promote engagement with suicide prevention services and suggest ways of improving a veteran's social support. In this module, we've covered the challenges faced by veterans, such as mental health difficulties, the militarized threat system, moral injury, survivor's guilt, making the transition to civilian life, and complex risk presentation. We've also explored how the likelihood of challenges increases with the time a veteran spends in the armed forces, and the implication that these challenges pose for clinical practice.